Well, 1 in 8 women is affected by breast cancer over her lifetime. Knowing your risk and what to do about it is key for prevention and early detection. Today, we're joined by Kelly Jensen. She's a high-risk and genetics coordinator at Trinity Health Muskegon Breast Center. Now, Kelly helps women understand their personal risk for breast cancer and then guides them through individualized care plans. Kelly, thanks so much for joining us.
Well, thanks for having me.
Let's talk about what makes a woman at high risk of having breast cancer.
Well, there's several things. I mean, we just being female is the number one risk factor.
There you go.
But aging will increase risk, as will certain lifestyle habits, and family history is a primary risk factor.
Okay, perfect. So let's talk about some of those lifestyle changes that women can make and be conscientious about.
So we know that alcohol consumption, especially if it's in excess, will increase breast cancer risk. We know tobacco is just not a good health choice as it is.
Right.
Obesity after menopause and early menarche, or not having children by age 30, which is something that most people don't know.
Okay, yeah, I did not know that. But so let's talk about then the special care that you can provide for women who may be at high risk.
Sure. So we will address risk, and that seems like a pretty broad statement, but we look at different moving parts about the person's individual history as well as their family history. So often it's not just, do they have a family history? It's who in the family had breast cancer, what is their relationship to them, and then what are their personal risk factors, like previous abnormal breast biopsy, those types of things.
Okay, perfect. So how does a woman get in to get this specialized care?
Well, we try to screen people when they come in for mammograms. However, I mean, they can certainly call the breast center directly, but you don't need a referral, and you don't need you need an appointment for mammogram, but you don't need a referral.
Okay.
So often they're screened that way.
Okay, perfect. So you can just give you guys a call and get in there and make it part of your regular mammogram.
Yes, you can. It's not automatically. There's a brief assessment when a woman comes in for her mammogram, but it's not the in-depth risk assessment that you get when you kind of take it to that next level.
Okay, perfect. And you know, nothing better than taking charge of your own health care. Let's talk about what makes Trinity Health's breast care unique.
So we have worked very, very hard and diligently to meet some very high standards. So we're accredited through the NAPBC, the NQMBC, and the American College of Surgeons. And so we have all of these professional organizations that set these standards, and then we have aimed to meet those care recommendations for the patients.
Okay, perfect. So if someone wants to learn more, talk about the ways they can get in touch with you.
Well, they can certainly go to the website, through Trinity Health.
Yep.
They may call the office and look them up online and call us like so many old school people do.
There you go. You can do that.
And that's
Perfect.
okay.
All right. Thank you so much, Kelly. We appreciate it.